Hi, and welcome to the Anti-Waffle Podcast of Em and Pixie.
Woohoo!
And together we'll try to talk about research about to be gobbledygook. Each episode we'll be talking to a researcher who will discuss the work they're doing, looking at why this research is important and asking how did they get into this field. We hope that it will be informative and interesting and bringing a bit of the academic world into the real world. Today we have Dr Sam Searle, who's a PhD student and a geriatrician in Canada. Thank you very much, Sam. Thank you very much for being here today.
Pleasure.
Thank you for talking to us. Do you want to start by telling us a bit about your research, please?
Sure, yeah. So my research is all dictated from the clinical work that I've done. And it's understanding how medically complex patients, so people with a lot of health issues, how they recover decline when they've developed a new health issue and come into hospital.
Oh, wow. So it's like, so when they've got several issues, it's about how their body reacts and just their body, or like how their mind or their emotions reacts to a new disease coming into the mix?
Yeah, all of that, really. So I'm fairly young. I'd be considered a millennial, a snowflake. However, the real snowflake are these medically complex patients. When I get sick, say I've got a pneumonia or something like that, I cough, I have trouble breathing, I spit up stuff maybe. I come into hospital, they say, oh wow, you have a pneumonia because you have all these symptoms, it's quite clear. And I'm like, yeah, I have trouble breathing. They give me antibiotics, maybe I'm better in a day or two or three, and then once my pneumonia has resolved, I feel tickety-boo and I go home.
Yeah.
The problem with medically complex patients is when they develop pneumonia, well, first of all, they may not even be able to explain these symptoms, so it's very atypical. It's typically atypical for them.
Yeah.
And then all of the other health issues that they have actually become aggravated and more relevant than the actual pneumonia. Because the pneumonia, we can treat that with antibiotics. But the problem then comes is, their heart issue acts up, or their diabetes, or they aren't able to walk like they used to walk, or they no longer are able to go to the bathroom by themselves, feed themselves. Mm-hmm. So all these other things actually become almost more important than the actual pneumonia. And the problem is, additionally, is that the healthcare system is organized to deal with people coming through the door to treat that acute issue. And we're not really organized to treat those near infinite combinations of other things that can be aggravated as well. And yes, it can affect their psychological well-being. People can get depressed from this and such, yeah.
Wow.
And is this purely older people that you're looking at? Or?
Well, there's a bit of controversy with that. I would consider mainly medically complex. So, there's a lot of older people who don't behave like this because they haven't developed multiple health issues. But the odds are, if you live long enough, you will develop multiple health issues.
Yeah.
And there's younger people who have developed multiple health issues that behave like this as well. It's much, much less frequent.
Wow. That's really interesting. Because you were saying like they'll deal with the acute issue, but do you find that a lot of the acute issue can be missed because that they're already experiencing those symptoms? Does that make sense?
Don't know if I quite follow.
Or is that not what you're looking at? So like with the coronavirus, everyone's saying, if you've got a cough, then... But I've always got a cough around this time of year. So it's like, well, is my cough to do with the coronavirus? Or is this so I'm assuming I haven't got coronavirus because, well, I'm always coughing at this time anyway.
So I don't do specific research in coronavirus, nor have I done specific research in other viral illnesses. I have lots of colleagues and friends who do that. Yeah. So I can speak to it based on what they know. We know that when older or medically complex people get sick, they get sick atypically. So they may not have a cough or they may not have those symptoms, but they still have it. They present in very typical ways, which is what I do study, and they recover in very typical ways. They can't move, they can't do the things they usually do, or they may get confused, they may fall.
Right.
So one of the concern that we have with influenza, but also with coronavirus is, a lot of older people who are medically complex, maybe they don't develop a fever, but they still have it, and they still are at risk for having complications. But it's harder to recognize that they have that problem because their body doesn't react the same way that a younger person's would.
Right.
And conversely, when they recover, they don't recover the same way either.
Right. Okay. Right.
So how long have you been doing this research for?
I've been doing research since 2008. I've been working on my PhD for a year and a half.
Cool.
Concurrently with my medical training, which was when I started. Yeah.
And what is your long-term picture with the research that you're doing now? Once you have a better understanding of how people with multiple sicknesses, illnesses, things, how they react, what are you hoping to do with the information? Who is that going to help? Who are you going to pass